I'm a gastroesophageal surgeon, mainly concentrating on the diseases of the gastrointestinal tract. One of the common symptoms for which patients come to me is called heartburn. They complain there is a severe burning in the upper abdomen, also along the chest, right up to sometimes to the pharynx. This is, in medical terms, called gastroesophageal reflux disease. Normally, the stomach produces hydrochloric acid, which is essential for the digestion of the food that we take every day. The acid does not come into the esophagus or the food pipe by a muscle called sphincter, lower esophageal sphincter, or medically called LES. This LES relaxes, the acid comes to the esophagus or the food pipe, which causes the burning sensation. That we call as a gastroesophageal reflux disease. Why do some patients get the reflux is multifold, the threefold I would say. One, excessive secretion of acid. Two, some of the food that the people consume or take, and the wrong habit of immediately going to bed after a heavy meal. These are the three factors which are responsible for lowering the LES pressure, as a result of which the sphincter relaxes, acid comes back into the esophagus. Normally, at home, we preserve acid in a porcelain jar which is very thick, similar to the stomach. The stomach wall is very thick, it is able to stand the effect of acid. On the other hand, if acid comes to the gullet or the esophagus causes burning or it causes ulceration. This is called gastroesophageal reflux disease, as we have mentioned. One of the reasons why this happens is taking excess of fried food, oily food, is a result of which the sphincter relaxes. Another reason I would mention, commonly come across, is taking excessive tea, coffee on an empty stomach. People usually, when they are hungry during their work, they will say, I'll have a cup of coffee, then go home and have a dinner or lunch. See, the house is burning, you have to pour water into it. That is when you got the feeling of hunger, you have to put stomach food into it rather than tea, coffee. It is like pouring, instead of water, you are pouring petrol. Coffee, tea will increase the hydrochloric acid secretion, increase the heartburn. The common mistake that is I found among the people is garlic is good for your health. Maybe it is good because it will lower cholesterol, etc. But garlic lowers the lower esophageal sphincter pressure, as a result of which it regurgitates. So garlic is not good for the people who have this reflux or heartburn. Then three, fatty food and fried food. Anything that is fatty and fried again lowers the lower esophageal sphincter. Third is the cigarette and alcohol. All again lower the lower esophageal pressure, it increases the acid secretion. So the treatment of reflux is mainly to avoid certain things like cigarette, alcohol, garlic, fatty food and fried food, and going to bed immediately after a heavy meal. If these things are modified, these things are given up, people will not have reflux. In those cases where, in spite of the lifestyle modification, they persist to have the symptom, then we have drugs which not only reduces the hydrochloric acid, it also increases the sphincter of the lower pressure of the lower esophageal sphincter. That is one comes in handy. But 50% of the treatment comes in lifestyle modification. I hope people will understand it and avoid their wrong habits. Thank you.